Hey everybody, this is Munson Steed, and welcome to Health IQ here on Rolling Out. It is where we bring those dynamic physicians who are trusted voices of both healthcare and the intellectual capacity that we need to increase so that we know more about our health from the individual who has studied hard and is here to provide service to us to heal and help us understand where we are today. I'm so proud of this one physician. She has done amazing work, truly has a program and a heart for serving her community, the one and the only Dr. M. Dominique.
Maya,
How,
I'm well. I'm well.
where were you when you decided that you wanted to be a physician?
I was not in a particular place. I know that it was a calling from God, only because as long as I can remember, so I typically will say 5 years old, but as long as I can remember, I've always wanted to deliver babies. And so I know as a 5 year old, I did not have a physician in my family that I was looking up to. So I just know that it was a calling from God and now I'm here.
You could have a calling, you could have a 9 to 5, you could be doing, but you've decided to take action. Maternal mortality is a thing, and you're not sitting on the sidelines saying, "Girl, I hope you make it. I'm already paid. I'm a physician." Can you share what you have done to make a difference in our community? And I want to applaud your effort.
Absolutely. So, before I became a physician, I really knew that it was important that I really got to understand people. And so, even when I was in undergrad, I decided to do a lot of traveling abroad or study abroad programs. So I would learn different cultures. So that's where I started there. I then became a CNA, which is a certified nurse assistant. So I could just be in the space in the four walls of the hospital and just really start at the beginning, right? Where I was at the bedside talking to the patients to see what their needs were. When I was in medical school, I was accepted to Rosalind Franklin, which is in Chicago. So that put me at the center hub where there are a lot of different ethnicities and cultures, which was great. And then I went to residency at Mercy Hospital. So at Mercy Hospital, that's on the south side of Chicago, we mainly took care of African American and Asian women, African American, Hispanic, and Asian women. Honestly, I can count on one hand out of all of the hundreds of deliveries that I did at that hospital. I probably only interacted with less than 10 Caucasian white women. It was a cultural thing. And while I was in residency, that is when the news really started coming out. Black women are dying, Black women are dying. We have to do something about it. Before, there was not a lot of research that was being done, so the numbers weren't showing anything. So people really didn't know. But that's when it was like, whoa, I am in the right place at the right time to take action. And that is when I started to really see the inequities that existed within African American women, why we were suffering, why these particular instances of maternal morbidity and mortality were happening to us. And I got a first seat view into what was actually happening because I was right in the space where the women were at.
When you think about that, you could have just stayed watching and not wanting to take more action to kind of prevent that. What did it make you do, and what should people understand when they become pregnant? All the things, if you had a top five of what you want that mother and family tribe to understand to get her to not be a part of that maternal mortality or morbidity at all.
The first thing, it really starts with preconception. So and when I say preconception, this is before you're pregnant. So if you're even thinking about being pregnant, you really need to put yourself in a position to where you're at your optimal health, right? So you want to make sure, because it's not when you get pregnant how the body actually reacts, it's before you're even pregnant, right? How that placenta is going to form, and the placenta is what feeds the baby. And so typically it's you want to make sure that you are really at a good weight, right? Because you're going to be gaining a lot of weight during pregnancy. You want to make sure that you are eating lots of fruits and vegetables, that your vitamins are optimized. So like your nutrition values in your body, that those are optimized at that time. And then when you get pregnant, really it's the support, it's the community, right? That makes sure that not only the mom is aware, but they're aware of different issues that can occur during pregnancy, because pregnancy, it's a natural thing. It should naturally occur. Typically, it should mainly be low risk, but there are situations where it can be high risk. And then I actually created a thing through my nonprofit, which is the top 10 questions that you should ask your physician. And I'll just give a couple of those. One is, do you know the hospital where you're delivering at? Because sometimes we don't realize that we have our hospitals are tiered in regards to the resources that they have, and it goes from level 1 to level 4. So a level 1 hospital is really just for just normal low risk deliveries. All the way up to level 4 is where they do more, I mean, they can take care of any baby practically, and they also can do fetal surgeries at that hospital. And most of your hospitals tend to be between the level 2 and level 3 when you're in like your city areas, but in your rural areas, they can be level 1. And so if you go to a level 1 hospital and you're having a placental abruption, there's no physician that's at the hospital, there's no anesthesiologist at the hospital, that could be life or death between you and your baby. So there are things that you can for sure ask your physician to make sure that you are equipped to know exactly where you should go. And then it is some cases where women are, they're in these rural areas where they can't necessarily make it to the hospital. So you want to make sure that you go to the nearest hospital that you have. But definitely, I would say preconception is one of the most important factors to optimize your health before you're pregnant and when you're pregnant, making sure that you are taking care of yourself in regards to nutrition, which sometimes is hard depending on where you live. And as we know, in African-American communities, we have a lot of food deserts. I work in Gary, Indiana. It is a food desert. My patients do not have the ability to go to grocery stores with lots of fruits and vegetables. So some of these things are actually systematically set up, which then put women in these terrible positions. However, if you can take on, right, you find the programs, and we'll talk about that later, but you find the programs that are there to support you so you can make sure that your health is optimized before, during pregnancy, so you can decrease these outcomes from happening to you.
Let's talk about that. And I thank you for that. I don't think you got through one or two of your top 10, but we'll come back to that. Really, when you're there and you're in a food desert as a mom for nutrition, how can she meal prep and how can we ask? And I've often said this, Dr. Dominique, baby showers for our community should be showering the mom with a program for her to live the next 18 months. Like, I think that it's great the baby's coming, but if we don't make these showers of love and showers of support, I think we're missing some of the biggest moments when everybody is excited.
Very good idea. That's a brilliant idea. Yeah, it really does, I mean, I think that would be great if we did utilize that. But I would say there are typically, for instance, I live in Indiana. Indiana in Lake County, we're right outside of Chicago. Gary, Maryville are some of the main, of course, people pretty much know Gary, Indiana. There are a lot of programs in this area because of our high instance of infant mortality. In Lake County, that Gary area and Maryville is the highest area of infant mortality where our babies die before age 1. And our Black babies are, I'll give you just an instance, the national average is around 5.6 out of 100,000. We're at 14, right? So we are almost 3 times likely our babies by age 1 to die. And when you look at babies that pass away, you look at really the health of the community, because they're going into this community, and this community is the one that's supposed to keep or thrive them. But if they don't thrive, then that lets you know that it's really the community. And so there are a lot of resources. Like, for instance, I actually have a meeting this week with a Black farmer that farms fruits and vegetables in the community to make sure that the community has what they need. There are many programs that are here that make sure that the moms have what they need. But I will say that it is lacking. Nutrition education is lacking. And that is one of the reasons why I've sort of stepped out of the four walls of being a full-time W-2 physician. I'm now an independent contractor, so I could follow into my passion to make sure that I could actually bring these nutrition programs to the women. Because what happens is we can tell them what to eat, but most of the time they're like, but I don't really know what to cook or what does that look like? And so even last year at one of my health fairs, what we did is we actually did a full culturally sensitive menu. We had baked chicken, we had collard greens, we had a sweet potato, we did a vegetarian chili, we showed them how to do a smoothie, and none of this was made with any sugar and salt. And we kept it as we made sure that we didn't tell anyone that it was no sugar and salt. So we fed everyone, the kids were coming up, everybody was coming to getting second and thirds, and then we told them it was no salt and no one could believe it. But what we did is we equipped them before they left with the recipes for what we created to make sure that they understood that sometimes culturally we just think that we need the salt or we need the sugar, but we don't realize that chicken, right, is a meat that already has sodium in it. So all you have to do is prep your food using natural seasonings to bring out those flavors. The salt is already there. And then as you start to get your taste buds used to not necessarily bombarding it with so much salt and sugar, you can start to appreciate the flavors rather than it being overtaken by the sodium.
When you are called, and obviously you are, to heal and to be a what I would call an institutional builder for our community so that there's a bright light for those moms. If you had to speak at Spelman or Clark, what would you share with some of those young women or women that are at Meharry or just any about how important it is for our community, both male and female, to become healthcare providers and professionals?
Yes, I want to let them know that I feel like now the narrative is, if you become a doctor or if you become like an advanced practitioner, that your life is sort of just you're not gonna have time. You're always gonna be in the hospital. You're always gonna be on call, and especially what I do as an obstetrician gynecologist. But what I'm finding out is healthcare is very vast, right? We need so many different players in this space. If being in the hospital is not your thing, that's okay. We still need you. We need people that are researchers. We need people that are in technology. We need people that are going to sit on the bench and create new products and medications that are feasible specifically to the African American community and that are culturally sensitive. There are other ways to create your career, like myself. So as a independent physician, I can create my schedule how I want to, and I can still go after my passion. So just because, and then the other thing I hear is, oh my gosh, 12 years is so long, because you do your 4 years of undergrad, you do your 4 years of medical school, and then you have to do either, depending on what you go into, 3 years, and it can go up to 8 years if you're doing something like neurosurgery in your residency. But I think as young adults, we don't realize how fast time goes. Like I graduated from high school 20 years ago. That time is gone, right? And so sometimes we think like, oh, well, I want to do something that's quick and fast. But if you're really following your passion, if you're really doing what you really want to do, that time will go so fast and you'll be able to you'll be able to live out your purpose, right? And not think about 12 years of my life is gone. So there's so many options, and we need brilliant minds. We need the brilliant minds of the individuals that are at these HBCUs to come in and make a difference in our community, because we are the ones that's really stepping up to the plate to make sure that there's a difference within the Black communities. And we need the Black community to be represented at the table to make sure that we have that voice.
Thank you for that. When you decided to really start branching out, can you share more of what people can expect and enjoy and how you program a health fair to celebrate these moms and to educate them?
So yeah, I just recently changed it. This is the second year. So the first year, I was still a full-time physician, and my husband he'd been hearing me for years talk about my dream of starting this nonprofit and how I was going to decrease maternal morbidity and mortality, but I just did not have the space and the time being a full-time physician. I was covering 3 hospitals at one point. And so he was like, we're going to do a health fair. And to be honest, I was just like, I have so much on my plate to do a health fair. It is the best thing that I started to do. Number one, in Lake County, we really don't have a women's health fair. So it was a space that I could step into to really make a huge difference. I really had a large following in this area because I've taken care of a lot of the women in the area. And so, we have great relationships. And we created this wellness fair, well, health fair last year in a matter of like 4 months. And I had about 30 vendors that came in. And of course, like we had the nutrition, we had free haircuts at that time. And so I'm thinking maybe like 100 women were going to show up. We had almost 400 women and children, family members that were there. We gave out a ton of gifts. And so this year we started it back in September, and I changed it from a health fair to a wellness fair, because what I understood is that it was so important, since I'm not in the four walls anymore to discuss this with these women. I know what they told me when they were there. Their health and wellness was not just about, did they come to the physician, but did these women have a safe place to stay? Did these women were in abusive relationships? Did they know where to go? If they didn't have, formula or diapers for their baby, where do they go? Some women told me they wanted another job. Other women were in hair school. Other people wanted to learn how to be a nurse. And so what I did was I just put that all together and I said, this is going to be called a wellness fair, because our financial health is important, our mental health is important, our physical health is important, and as well as our health just in general, our wellness. And so this year right now we have 88 vendors that are going to be in the room, that range not only from health, but workforce development. I have the Navy, the Army, the Marines, they're coming for recruiting. You never know who might want to go into the services, because we also need workers, of course, in the services. I have a realtor that will be there to discuss for people who may want to buy a home, who have thought about buying a home and really don't know that they qualify for certain programs. Of course, we have mental health that will be there. And then we have, of course, the giveaways. So there's free haircuts. And this year I included free hair braiding, because wouldn't that be amazing if the moms could come and their little girls could leave and they feel great with their hair braiding? And then we added on a lot of screenings this year. So when moms may not know that their children, they're living in these homes, right, that may have lead in the paint. And so you can come and get your child. So lead testing, we children that will be there, sexually transmitted infection disease testing will be there, immunizations will be there. So there are a lot of different things that we now added on to make sure that the women in this area, since like I said, I'm not inside the walls anymore, that I'm bringing everything together under one roof in one day. So if you can just make it out, you can just get there. I don't have transportation yet, but that's definitely coming. You can just make it out to that one day. You should be able to leave equipped and armed with the things that you need to take care of your family. And it's not just for women, it's for the whole family. We're including the men this year. We're making sure that we survey the men. We have surveys to make sure that we pick up what the patients and what the participants in the community needs. But we have a men's survey that we're doing to make sure that we know how they feel when their partners are pregnant, when they're becoming fathers, what they need to make sure that they are equipped with the knowledge to make sure they can take care of their families.
Great job, Doc. Well, I want to thank you for continuing to serve this community in a special way. It's happening this weekend. Is it this weekend?
So it is next weekend, and it's April the 26th, 2025. It is going to be at the Dean and Barbara White Center in Maryville, Indiana. That address is 6600 Broadway, Maryville, Indiana, 46410. It's going to be from 11 to 3 o'clock. And if I could just give a quick shout out to my sponsors, if that's okay. So my sponsors that have supported me with this, number one, I want to say thank you for this interview today. If I just touch one person, or people understand the importance of making sure that these are done, it's Black Maternal Health Week. So I am not alone in this fight. There are women all across the country this week that are making a huge difference in regards to Black Maternal Health Week. But thank you to you for supporting me with this. As far as our sponsors here locally, we have the Legacy Foundation that has supported us, Miriam Health Centers, Methodist Health Centers, as well as Care Source, Youngblood Youth Development Home, and the Urban League of Northwest Indiana.
Well, thanks to you, Dr. M. Dominique, for all you and my brother, your husband, for having the vision and pushing you toward your prayer and dream, because prayers and dreams need to accompany each other if
Yes.
you want to realize them. So I'm excited about it. I'm really proud of you. We got the information. I wanted the community to know that there was one more sister putting a light in the sky for both hope and the love that our community may not have had, but now is receiving from you and your husband and your family and friends, and obviously thanks to the sponsors, but for you, for having a dream for those who may be dreamless, may be foodless, may
Mm,
be lonely, may be
yeah.
alone in pregnancy. And now she knows that at least one day out of the year that this sister put up a bright light and said, hope is eternal if you just come and participate with Dr. M. Monique.
It's not just myself. I started a nonprofit which is called Prenatal Well. So they can go follow me at Prenatal Well on Instagram. We're also Prenatal Well on Facebook, and that's where they can find out all of these tips that we were talking about in regards to making sure that they are taken care of. So Prenatal Well is a nonprofit organization that is making sure to make a difference with maternal and infant morbidity and mortality. They can meet me there. They can send me messages there to make sure that if they need anything from me.
M. Dominique, prenatal well. This is Rolling Out Health IQ. We celebrate you. We appreciate you. We pray for you. And we know that this world is a better place because you have chosen to serve the community. I'm Munson Steed, and this has been Health IQ. Share it with a friend, and we celebrate today the one and the only Dr. M. Dominique. Thank you.
Thank you so much.